So now let's look at clinical features of acute compartment syndrome. Let's do a deep dive into it. Early signs of acute compartment syndrome can be very subtle, and physical exam alone is not reliable. In acute compartment syndrome, you have to note that you have to do serial exams because that is critical. And waiting in a case of acute compartment syndrome is not good, because waiting in acute compartment syndrome is equal to muscle necrosis, muscle death. Now, the other thing I want you to remember that when we bring this friend of ours in MedCognito, it means you need to pay particular attention. What is the core clinical clue in acute compartment syndrome? It's pain. Pain out of proportion. Pain is the king, and everything else is just in the royal court. So pain is the earliest sign, but this is the most sensitive early sign. Pain with passive stretch. To stretch the muscle, stretching the muscle in the affected compartment, it hurts like fire. You've got a problem. So pain, so for example, you have a patient with trauma to maybe the upper arm, and then when, for example, there's finger extension, the patient says, I have pain. Start thinking, there could be a component of compartment syndrome, which is brewing. Or if the patient has pain with passive dorsiflexion, where that means that there's stretching of the anterior compartment, that means there's a problem. Another thing you also want to look at is that muscle feels like rock hard sausage, then there's a problem. And if there are neurovascular changes, but remember, the neurovascular changes are late signs. So the early sign is the pain. Neurovascular changes are late signs.